3 doctors at Princess Margaret Hospital were suspected to have been infected with Shiga toxin-producing E. coli. One of them died 3 days after developing symptoms. The deceased doctor was reportedly around 30 years old.
More details about the infection cluster came to light from the Center for Health Protection in its late afternoon press conference. It said the case was reported to the center on Monday. The 3 doctors working at the Oncology department of Princess Margaret Hospital began experiencing symptoms including fever, abdominal pain and diarrhea on the 4th, 6th and 10th of this month respectively. The doctor who first displayed such symptoms was admitted to hospital last Thursday. He was already in serious condition, having a high fever with low blood pressure and low blood oxygen saturation level. He passed away the following day. The 2 other doctors had milder symptoms. One of them tested positive for Shiga toxin-producing E. coli. The other 2 doctors, including the deceased, tested negative. CHP said they are tracking the source of infection. While the trio did not dine at the same restaurant, they all used the 6th-floor lounge at the hospital, including the work area and toilet there. Authorities have collected over 60 samples for analysis and are investigating whether the patients consumed any infected food or whether the environment was contaminated by the bacteria. Dr. Albert Au, head of the Communicable Disease Branch of the Center for Health Protection, said the 3 infected doctors all work for the Oncology department, so the source of infection was unlikely the hospital restaurant, which would have led to more cases across different departments. Professor Kwai Chung, chair of infectious diseases of the Department of Microbiology at the University of Hong Kong, said it's rare that infection of Shiga toxin-producing E. coli will lead to fatalities involving a healthy person, and more investigations are underway. CHP said the annual tallies of Shiga toxin-producing E. coli infections are between 0 and 6. Most infections are related to the consumption of contaminated food or water, including raw or undercooked meat, especially ground meat. Feces, contaminated fruit and vegetable, as well as unpasteurized dairy products can also be the sources of infection.